Today, your host for the event are myself, Melody Howard. I'm the Community Alliances Director at MedicAlert Foundation, and also Julie Hilton, our Vice President of Communications. Welcome, Julie. Great. Today's agenda, we'll be covering a little bit about MedicAlert. We'll have a session which we'll spend most of our time on caregiving and aging in place, adapting to the new normal, Q&A with PORTIA Singh, and then we'll share some resources for you. So a little bit about MedicAlert. For those of you who've joined us in the past, we welcome you back. For those of you who may not be familiar with MedicAlert, I'll take a few moments to share some information with you about our life-saving organization. MedicAlert is the original medical ID created in 1956. What's so unique about MedicAlert is that we go beyond just an ID. Our IDs are backed by our dedicated emergency response team 24/7. This team is always standing by to relay your critical medical information to those treating you in an emergency. MedicAlert is the only nonprofit organization in the medical ID space. All of our revenues fund our emergency services and help provide IDs and memberships to people in financial need. Our mission over the past 64 years has never changed. It's still to save and protect lives by sharing vital information in our members' moments of need. Here's how our service works. Your MedicAlert ID is engraved with the most vital information that first responders need to know right away. In an emergency, they contact our 24/7 emergency response team to get your full health record. Your health record includes additional health data and emergency contacts, which we relay in an emergency to emergency personnel, again, which we relay at that time of the emergency. We've trained first responders to look for your MedicAlert ID, empowering them with vital information. So important that first responders know about any existing conditions that you have so that you can get the best possible care. MedicAlert is your voice when you need us most. Today, I am very excited to introduce you to our guest, Dr. PORTIA Singh, Senior Research Scientist at Philips Research North America, located in Cambridge, Massachusetts. Dr. Singh's research focuses on developing solutions to help seniors and their informal caregivers better manage their health at home. The research bridges traditional hospital-based physician-focused care to self-managed, preventative, and continuing personal care, thus targeting the entirety of the care continuum. Prior to beginning a career in industry research, she serves as the Hardy Apfel IT Fellow at the Social Security Administration, where she worked on disability policy and technology research. This also afforded her the opportunity to serve on President Obama's second-term agenda cross-agency work group. Dr. Singh received her doctorate degree from Carnegie Mellon University in biomedical engineering and a bachelor's of science degree in computer science from Grambling State University. In her free time, PORTIA enjoys exercise, spending time with family, and mentoring students interested in pursuing STEM's degree. Welcome, Dr. Singh. I don't know if she can hear us.
Yep. Should be able to hear us now.
Looks like she's connecting to audio. PORTIA, are you there?
I'm here. I'm just unable to start video.
Okay.
We are working on that.
I'm here, I promise.
Okay. Well, I'm not sure what's going on with that, but we'll move forward. Thank you for everyone who submitted all of your great questions. We're going to answer questions in the following categories: caregiving, aging in place, keeping fit, staying connected. And without further ado, we will move to that first question, submitted by Kim. What is one of the biggest misconceptions about seniors and aging that you have uncovered in your research?
So this is a great question. Thank you, Kim, for bringing this up. And I think a very good one to start our conversation around. I've had the opportunity to speak to many seniors and their caregivers over the course of years. And some of the things that I found are big misconceptions are that this idea that the senior should be okay with needing help as they get older. We have full lives, hopefully, and a lot of experiences that it doesn't make it easy or easier because you are growing older to actually acknowledge, accept, and then ask for help. So just as caregivers, it's good for us to remember that this may be a tough transition phase for the senior, and that we should take care in the discussions around needing help. Can you see me?
We can.
Awesome. Hello.
Okay.
All right.
Glad we got that sorted out. Sorry for the rough start there.
No problem. And that leads me to the next point, that a misconception is that it's easy to ask for help. I feel like a lot of people have trouble asking for help from others, and that does not change as you're aging. It does not change because you now, a person needs assistance with different things. In fact, it may become even more difficult for a person to ask for help, especially when they need so due to limitations that are arising because of aging.
I think there's also a little bit of a pride thing too. Like, you don't want to admit you need help sometimes.
Yeah, that's a good point, and that's one of the things that I've heard a lot speaking with seniors is there's a little sense of pride, but it's also wanting to continue to have a level of dignity. And depending on what type of help that person needs, if it's something that requires them to be in a very intimate space with someone else, like, for example, bathing or toileting, it becomes a little more difficult to then reach out and ask for that type of help. Another misconception is that aging is the beginning of some end. Yes, aging can pose challenges for people. However, there's also great opportunities in aging. I like to say, if you look at it as a new set of chapters in your life, that this could be an opportunity to fill it in with adventures, with new learnings, with happiness, with joy. There's a different phase in life that a person will be entering as they age. And as caregivers, I think looking at it as there's an opportunity here. And if I can help provide support that allows my loved one to then be able to focus on the positive aspects of aging, and increase the quality of life, because there are some things or experiences that you may not be able to have until you reach your golden years. And so I encourage people to think, yes, there's challenges, but also think about the positive aspects of aging, and they should not be left, I guess, unnoticed. And then the last thing I want to really point out, and this goes back into the difficulty potentially of asking for help, is there's a misconception that seniors, and in general people who are living with any kind of disability, so even younger people, no longer want to or can do anything for themselves. And this is something that we may think, I see this person having difficulty with this particular task. Let me do it for them, as opposed to seeing, okay, well, I recognize that you still want to be able to cook for yourself, for example. How can I help you fill in the parts of that task that you can no longer do, while also preserving the joy that cooking brings to you? So that's just an example of how we can look at caregiving as augmenting things that a senior may be unable to do, while allowing the space to elevate those things that they are still capable of doing for themselves.
So for somebody that really enjoys cooking, doing some grocery shopping for them could be really helpful to make sure they have the things they need to cook for themselves.
Exactly. And even things as simple as reorganizing the kitchen for them so that they can safely access different ingredients that they normally use, as opposed to having things on higher shelves. So there's room for creativity in how you can provide care to someone. And I encourage people to think through what is the actual need. Do they need you to take over all of their meals from top to bottom? Yes, that'll be the case for some folks. But for others, it may be as simple as saying, okay, well, I'll help you with groceries, and I'll do groceries for you every week.
Right. You know, there's one more element to this that I think we talked a little bit about earlier when we spent a little time prepping for today, was, and actually one of our members, Bonnie, sent in a question. She said, like, I'm the designated senior. I try really hard not to be too needy. And I know my mother is constantly saying, well, I don't want to be a burden. I don't want to be a bother. So, you know, sometimes it's letting go of that to be able to ask for help.
Yes, and that goes back to the fact that it is difficult to ask for help sometimes. And I don't know how many times I've heard from a senior saying, you know, I just don't want to be a bother. And also hearing from that person's caregiver saying, I really wish she would ask me because I have time. And so the one thing I want you to take away from this, if you don't take anything else away from this, is that communication really, really, really is key in having a healthy caregiver and care recipient relationship. And sometimes just speaking with the person and having an open conversation about issues may be enough to, you know, get over that hump and say, well, you know, mom, you know, dad, okay, well, if I told you that I usually take my lunch break between these hours and that I want to help you between these hours, can you then tell me what you need? And then I'll just schedule it then, so that it's a dialogue of, I understand you have needs. I understand that you don't want to appear to overburden me. Well, let me give you a look into my schedule so that you can see this is not in fact a burden. And that's just a simple way of allowing more dialogue and transparency.
Well, I think talking about communication is a great transition into our next question.
Right. This question submitted by James: what qualities should a caregiver possess?
Awesome question. And I'll say this a lot of times because the questions are pretty awesome. So communication we touched on, so I won't touch on that one again, but I would say the top quality that a caregiver should have is compassion. This ability to understand that the care recipient is going through something or is having challenges, and then adding on the desire to help them out. Because if you approach it with compassion, then you're you're setting up the ability to have conversations about what's needed and what can be done in a little easier fashion. And so I would say really approach things with compassion, especially when it gets difficult. I know some of you may be caring for individuals who have behavioral issues or memory issues and things that could be pretty frustrating. So approaching it with compassion, but then also patience. Patience is a virtue, and it's very, very hard sometimes to have. But it could be a difficult situation. However, understanding that you want to help out, and understanding that that person may be dealing with disappointments or pain if they're have a chronic illness, or just the uncertainty of what will happen tomorrow, especially in this day and age. And so having a little patience can go a long way. Attentiveness. You have to pay attention to the person that you're caring for. How that looks and how much attention you need to place on different things will vary on who you are caring for and what your role in that person's care is. And so if you are the person who is providing transportation to doctor visits, and the care recipient wants you to be in the room, then maybe being attentive as to what the doctor is saying and what changes are being made would be very important. If you're the person that's doing grocery shopping, you may want to be attentive to that person's dietary needs, but also what they enjoy eating. And so being attentive is a good quality of a caregiver. Trustworthiness goes without saying. If there's no trust in any relationship, then it becomes very difficult to move forward. But it's especially important as well in a caregiver care recipient relationship, especially if you are in a, I don't want to say non-traditional, because it happens very often that you have non-family caregivers who are either friends or neighbors who are helping the senior out. And so just establishing a trust between you and the care recipient, the sooner you can do that, the easier it may be to carry out the caregiving. And then the last one I want to say is a willingness to ask for help. It's understood that you are helping someone else as a caregiver, but caregivers need help too sometimes. And so maybe you've ventured into, or your loved one has ventured into a space that you're not comfortable with or you're not familiar with. Let's say they need a different level of in-home nursing care, and you just, maybe you get squeamy whenever you have to give someone a shot. Being okay with asking for help for that part of caregiving is perfectly fine and encouraged. It will help you to minimize the risk of caregiver burden and burnout.
I don't know if you're going to talk about this later on, but I think caregiving takes on a lot of forms and looks different to a lot of people. Is that something you want to speak a little later?
Yes, yes. Okay. Well, I can, yeah, we'll speak about it later.
Okay, yeah, I think all the qualities are there, but caregiving is not always a full-time thing. Sometimes it's a part-time, and it's often a shared responsibility with other people. Yes. So
yes,
that's sometimes you may not think of yourself as a caregiver, but if you're somebody that consistently does a certain task for your neighbor or for a relative, something, you're part of that caregiving family and community.
Yeah, and if I may say, that's a great point, because people may not look at themselves as caregivers, but also one quality, if you are in a situation where you are collaborating with other people to provide care to one or two individuals, then teamwork is actually a really good quality to have.
Yeah.
Absolutely. Moving on to the next question submitted by Lawrence. What are some good resources for caregivers online and otherwise?
So there are several nonprofits and agencies that focus on providing support and education and information to informal caregivers. They also have some that do nationally representative studies and surveys to really gauge what's the state of caregiving is for a particular year or particular decade. Some that I like are the Caregiver Action Network, the National Alliance for Caregiving, and the AARP. They each have a host of resources for caregivers, everything from how to help organize services for your loved one, all the way down to how do you cope with loss after, for example, your loved one passes and you're now, coping with loss. So really taking it the full spectrum of caregiving. There's also a lot of resources by the Department of Health and Human Services. And so they become a little more specific. For example, you may find a link on their caregiver page that would take you to caregiver resources specifically for people who are caring for Medicare beneficiaries. And so they approach caregiving in the concept of this person has Medicare and what programs may be available, not just to the senior, but also to their caregivers who are helping to support their aging in place.
And I just wanted to make a note, we did pop some of those links into the chat if anyone's interested in finding out more about those organizations, and they'll be included at the end and in some of the materials we send you afterwards as well.
So this next question submitted by Robert in the category of caregiving still. How do I cope when a person I'm caring for refuses to do necessary things like eating or bathing?
This is a great question. And it really gets down to what we call the activities of daily living and the instrumental activities of daily living. Both are very essential in being able to safely age in place. And so I would say to this particular question, open up a dialogue with your loved one to see why are you refusing, or why don't you like eating or bathing? What is it that is preventing you or making it challenging for you? Because in that question, you may be able to uncover a whole host of reasons, some of which can point to maybe a decline in their health status, which is very important to be able to pick up early. It could also hit to something as maybe that person no longer feels safe bathing because their environment, they perceive their environment to not be safe. And so a remedy for that could be putting in a railing. However, if you don't ask the direct question to understand why and approach that question with compassion and open-mindedness, because being able to have that trust to open up to you as to what they're really feeling about these activities will be very helpful. If you still are having trouble having this conversation, you can reach out to potentially that person's primary care physician, or you can go to one of the caregiver resources pages that we'll provide links to, and see if there are other services or other people that can come in and give help. If there is a for example, you are a son that's caring for your mother at the time for which she needs bathing support, she just may not feel comfortable having you bathe her. And so maybe the course of action there is to get someone to come in for an hour a couple times per week to continue to give her that dignity, while also making sure that she has good hygiene practices.
If you have someone that has been doing those things normally and then they stop or decline in those practices, is that ever a red flag for something?
that can be a red flag. So sudden or even gradual changes even can start to flag that there could be some decline. And so especially if you see a very sharp decline, especially right now with social distancing measures, with the stress that may be there for older adults who are worried that they're in a vulnerable population for the pandemic, reach out to a medical professional because it may be something that is a flag for a decline in health, sometimes cognitive decline. And you want to be able to catch those things early so that treatment can start as soon as possible. So yes, these behaviors that change very quickly or a noticeable trend downwards are things that you want to get outside or seek outside support for.
Okay, our next question submitted by Nadine, Vicky, and Stephen. Sometimes caregiving feels like a 24/7 job. What are some ways a caregiver can get downtime and practice self-care?
Awesome question again. So yes, there are about half of caregivers have very or high hour caregivers are providing care at a substantial rate for which burnout is possible. And when we think about self-care, I think this becomes a topic just in life in general, is that we prioritize what we find important. And so it is one thing to do is to start thinking of your own self-care as just as important as the care that you're providing to your loved one, and prioritize it. That will be kind of a turning point, because at that point, you have said, this is a non-negotiable for me. I have to take care of myself so that I can give the best care to my loved one. And once you prioritize it, take it a step further, write it down and schedule it. This will help drive home the notion in your mind that this is as important as a doctor's appointment, or this is as important as this work appointment. Our mental health and our emotional health and our physical health really is as important as those things. And if you have to put a Post-it note on your bathroom mirror until you believe that yourself, and if you have to speak it out loud as an affirmation daily, do it, because you don't want to get to a point where you've deprioritized yourself so much that you're now overburdened and you really don't know where to go. When I say schedule it, I mean schedule it, put it on a calendar, and better yet, share that calendar with everyone that's relevant. So if your loved one is also tech savvy, you can do a Google Calendar or your whatever smartphone calendar and share that out so people can see that this is blocked off for me. If they're not tech savvy, print out a schedule or a calendar and post it on the refrigerator and say, this is the little block of time that I will be taking for me on a daily basis or a weekly basis. And then you want to pick something that you enjoy doing. So yes, some of you may enjoy doing laundry. However, a lot of people don't enjoy doing laundry.
I don't know who those people are.
I don't know who they are, but your self-care should not include chores. Yes, unless you love it. And I can tell you a lot of different things, even if you love laundry, that you can do that's likely more fun than laundry. So pick something you enjoy and follow through with it. I will come back to just really want to emphasize the benefits of a shared calendar, especially when you have multiple people that are caregiving for the same person, as well as just establishing that transparency to the care recipient of saying, this is my schedule. You see all this free space? That's space that I can do things for you. So please don't feel like you're overburdening me. And that gives a shared responsibility for figuring out where we best, as a team being you and the care recipient, see how we can collectively get to what needs to be done in a time that works for everyone.
I think that's very helpful. I think a lot of people who are caregivers kind of feel guilty about the fact that they want some me time, they want some downtime. So I think that that's comforting to hear. You have permission to have some downtime.
Yeah, I'm a mom. I have a 21 month, it's a year and a half, and I struggle with this myself. So it doesn't go away. It happens to a lot of us. You just got to really prioritize it.
I always think about it like when you're on the airplane and they say, you know, if we're depressurized and the air comes down, right, you have to put on your own mask before you do someone else's, because if you're blacked out from lack of oxygen, you can't help save someone else. So you need to make sure that you're sustained in order to, you know, provide care to others.
Exactly.
Our next question, submitted by Martha. My sister and I have been caregivers for my mother for the last 2 years, but I don't want to do it anymore. Why do I feel so guilty?
This question really, really touched me, because this is such a normal feeling for caregivers to have. It is, Martha, what you are feeling is normal, and you should not feel guilty about it. There are ways that you may look to see, okay, this is how I feel. How do we move forward from there? I see you have a sister, so you are sharing care with a person. So I would say, if you're feeling like this, take a little time to think internally as to why you're feeling this way. Could it be that somehow you ended up with more responsibilities than you thought? It just kept piling on. Did something change in your household such that you actually don't have the time that you used to have? Are you at the point of burnout and you really just need to step away from things with respect to the caregiving duties for a temporary amount of time? And so I'd say do a little internal thinking and sitting with yourself as to why you're feeling this way. This would be a good opportunity to seek professional guidance if you find that, if that's available. So sitting with a therapist, even if you have a faith-based organization that you can turn to, or even a friend who is in a similar situation that you can talk to about this. And actually talk to your sister as well. You both may be feeling the same way, or she may feel that she can take up more of the load in order to give you a little more space to practice self-care. Take inventory of everything that you're doing and determine what can you still do and what do you need to let go of. Mm-hmm. And in that list of things that you need to let go of, determine whether or not there's someone else in the care circle. So I like to use the term care circle, which is the circle of people that are surrounding the care recipient who are collectively trying to help that care recipient maintain a high quality of life, usually aging in place. And so are there other people in the care circle who are not activated? This could be an opportunity to activate some additional support and also delegate out some of that load. Another thing you can consider is a temporary break altogether. So they have respite resources, which allows for, or it's services that you can access that allows for temporary planned or emergency support for a caregiver. So home health or home aides would come in and provide care to your loved one while you take a break or if something comes up. So there are both paid and organizations that also help to provide respite care. So check those out. And if you do all of that and you still are feeling overwhelmed, maybe take a look at what services are available to your loved one and find other people external to take in that. So if you're spending a lot of time on household activities, you can find an organization that provides a certain amount of hours per month for people to come in and provide household maintenance. If you are overwhelmed with providing transportation because of a volume of medical visits, there are organizations that provide free or subsidized transportation to elder individuals to go to necessary appointments and also senior centers and things like that. It really is important to determine whichever direction you decide to go is to try also talking to your loved one. Approach this conversation in a way that is vulnerable, allow yourself to be vulnerable, and then also talk to your sister as well. So keep communication lines open because you would want to preserve that relationship. And just because you are stepping back a little bit from caregiving doesn't mean you don't care, and it doesn't mean that you don't love that person. So so those are the tips that I would give for this situation.
It keeps coming back to communication, doesn't it?
It does, and it's so hard communicating. And some of us are good at it and some of us aren't good at it. But if you have to write a letter to get how you feel down and give it to them or mail it to them, do that. Take small steps until you can get to a point where you are able to openly communicate with that person, because it really will help. At the very least, you'll know how each other is feeling and can actually identify any problems so that you can find solutions for it.
Thank you. So our next question, and in the category of aging in place, we had several folks who had submitted these questions. I'm a senior. How can I get help for things I can no longer do? And is it safe to have caregivers come into the home during the pandemic?
So for my question about from the senior about how you can get help for things you can no longer do, there is an amazing resource called the Elder Care Locator, and it is a nonprofit. They have online a database where you can put in your zip code and find resources that are available to you in your zip code. You will have to do a little more I guess calling and filling out and applying for some of the services, but it's a quick way to see what is available in your area. Most states or cities have some level of area agency on aging. So I always mess this up, but area agency on aging, and you can get connected to your AAA on through Elder Care Locator. Another thing you want to do is look around and see who is around you that can help. So at the top of this, we gave a lot of examples of what are the good qualities of a caregiver. You may have people around you who fit those categories. They don't have to be all of the categories, but maybe, you know, someone who's trustworthy it's very important and dependable if they're the person going out and getting your groceries. So see if there are people who fit potentially the qualities that you're looking for someone to help, and ask them. Though I think we all have to get a little more comfortable with asking for help from the care recipient side, but also from the caregiver side. And then you can express needs to your doctor, your primary care physician, at your next visit, and they could connect you with resources or individuals from the hospital, maybe social workers, who can help you navigate getting additional support for the things that you're no longer able to do. And I guess the big thing right now is, okay, well, I found people to help me out. Is it safe for them to come into my home? So I will say that when it comes to safety, right now, especially leading into flu season as well, is to follow and continue to monitor and the World Health Organization and your state guidelines. But there are some things that I think can universally be applied that allows us to lower the risk of or increase the safety of having someone come into your home. And so if we're talking about informal caregivers, someone that you know and trust, but also determine, maybe practice safety measures like both of you wearing masks when coming into the home, hand washing upon arrival, social distancing when possible. So if the person is helping you change your light bulbs or maybe your smoke detectors, that doesn't require close contact. And you may be able to maintain a safe distance from that person the entire time you're there, or they are there, excuse me. You want to consider limiting the amount of time you have together. This is especially the case if maybe your one of your caregivers may be an essential worker, and so they may be at higher exposure potentially. If you limit the one of the recommendations from the CDC is to also limit the amount of time you're in close quarters with people. If someone's helping you bathe, it's harder. But if you're also looking at paid caregivers coming in, ask whatever agency you're working with what their safety measures are, and determine if those safety measures meet your standards of what you would hope someone would have coming into your home.
And I think it's always fair to set ground rules around that.
Yep.
It's your home.
It is.
Our next question, submitted by Nancy, Kathleen, Ray, and Pat. What are best strategies and practices for aging in place?
Another great question. So I would say first things first is think about what you need and what you really, what does aging in place mean to me? How does it look? If I could age in place in any way, think big or think, go ahead and allow yourself to think broadly, but what do I want in the next however many years of my life remaining with respect to aging in place? And then communicate that to your closest loved ones. Engage them to help you think about how does your care circle look? Who are the players? Who are the people that you want to stay informed as things change? Who are people that you're comfortable with having maybe tertiary support? So, someone that, a friend, a neighbor, someone that you trust, take stock of who those people are in your life. And then think about, okay, well, if this happens, maybe I can ask Sally. You want to communicate your wishes to your caregivers. If you are a caregiver who are wondering what the best strategies are, I would say your number one is to have a discussion with the care recipient and ask them, what does aging in place look like for you? Where do you see people coming in to help you? And at what level of care are you willing to have by your family, by your friends, by your neighbors, by, this is the threshold for which you need to pay for external people. So having those conversations are very helpful. You want to review the environment that the care recipient is living in for both functionality and safety. You want to prioritize preserving your mobility. So think about how can you stay active as long as possible. If you already are having difficulties with mobility, what kind of support can I get in order to help me increase that mobility or slow the progression of things like arthritis or osteoarthritis. And then the last thing I'd say, have an emergency plan in place, even if a person is not part of your everyday care circle. They may be considered for your emergency care circle. So, okay, I'm not comfortable having my neighbor come in and cook for me, but they're the person that's usually closest to me at all times. So maybe they are number one in your emergency plan. You can leverage technology in order to help increase the safety in your home. Philips Lifeline has a product, a personal emergency response button. Shameless plug, that's what I'm gonna say about it. And then we also have MedicAlert, who also has emergency support services and their band that you can use. So you can look at what other things you can add to your lifestyle in order to increase that safety part. And then the last thing is, from a best practice of aging in place, try to enjoy it. If you're talking about aging in place, you've already had a long life. You might have worked a lot, had kids, you may have, been in the hustle and bustle. Try your best to enjoy this phase in life. Because like I said at the beginning, it does have challenges, but it also has opportunities, and seeing where the joy can come in, even if it's with grandkids or getting to sleep in more, then yeah, I think all of those things are important to, try to also save place to focus on the positive aspects.
Right. I think one of the things that allows you to do that is having an environment that's safe and comfortable. And the next question, we can move on to that, is really about, like, how do I make my home safer? And just to make sure we stay on track to cover all the questions, I'm going to directly go to the next slide, which shares some resources that Philips has available. And again, we'll provide these links in the email that you'll receive as a follow-up. But there's some great material here on eliminating fall hazards and making your home safer. So we encourage you to check those out.
Yes, so I don't think there's much more to say for that aspect, but take a notepad and go around every room and learn how to pick up hazards. Very simple things like ramps in the front entry, removing rugs that are loose, adding railings to bathrooms, maybe moving certain elements if you're in a multi-level household to the first level if possible, downgrading the house altogether, so even physically moving out, or moving that person in with you. So there's a lot that can happen, but for this checklist is a very, very good one to start with. So I'd encourage everyone to take a look at the resource and see where you can apply this in your loved one or your own home.
So our next question, aging in place, submitted by Eleanor. What technologies are available or on the horizon to support aging in place?
Awesome question. So I love technology, and I love when we take technology and we either design it for universal use, or we take it and apply it to other populations of people for which we didn't necessarily think would be able to or would want to leverage it. And so there's so much that's going on that has benefits to aging in place. There's mobile apps and systems. I mentioned Philips Lifeline, but there's also other personal emergency and also security systems that are much more prevalent. There's technologies to assist you in caregiving. So we have a tool called Philips Cares that goes in tandem with our Lifeline service offering, but it really allows for this creation of a care circle and keeping people connected and aware of what's going on with the senior. And you as a care recipient also have access to manage this care circle in a digital way as well. You might have heard this term Internet of Things, but it's basically a bunch of sensors that are now being put in people's homes, everything from smart thermostats to monitors that can check utility use or turn off and on remotely different power supplies. And so these things become very important when you may have a loved one who has maybe some cognitive decline, and you want to ensure that they're doing things like turning off the stove. So if there's a meter that's showing how much gas, or that the stove is outputting a lot of power, if it's electric, you can turn that off remotely. There are sensors that you can wear. So I swear by the Apple Watch, other sensors to keep you active. And there's even, now with the pandemic, telehealth and telemedicine have become much more accessible to people. We've been talking about telemedicine and telehealth for a very long time, and the need for keeping people out of hospitals during the pandemic has accelerated how that technology has been used to provide remote access to doctor visits and also other medical support. So there are a few links in the notes, but yes, technology is coming around, and there's a lot that will be on the horizon to help out with both older adults and their caregivers.
Okay. Our next question, submitted by Mary and Nora. How do I motivate my spouse to do minimal exercise so he can maintain balance, get out of a chair, and avoid a nursing home? And any recommendations for exercise equipment for the home now that gym visits for seniors are out for a while?
Yes, so this is a topic that's near and dear to my heart, and that's exercise. So to motivate a spouse or loved one to do exercise, sometimes joining in on the task helps. And it is shown that activity or increasing activity can very much positively impact a person's mobility and their ability to age in place for a longer duration. And so by motivating, you can join in on exercise yourself. Some of the equipment that I would encourage is, if you are able to get your hands on some light dumbbells, that would be great, but those are hot commodity these days. So instead of using that, you can use 2 water bottles to hold in order to have some resistance. You can use 2 canned goods, make sure that they're the same weight. And then also a chair. There's so many exercises you can do by using a chair. And to the first question about exercising in order to, for someone who does have mobility limitations, the chair provides a safety for them to hold on to. And so we have these exercises from a seated position where you can do for both stretching and strength related. For some of these exercises, you can add weight to it. So again, those water bottles or those canned goods to intensify it, or you can do it just with your body weight itself. If you do have or feel that you need additional support, let your doctor know. There usually is access to physical therapy or someone who can come in and give specific exercises for you. Some conditions may benefit from more specialized exercises. And there are personal trainers who specialize in providing exercise programs for older adults. So if you didn't want to go into the physical therapy realm, or you don't have any concerns from your doctor, then you can look for personal trainers as well. And a lot of people are doing things virtually. So caregivers, there are so many more older adults that are logging in and have access to internet. And one misconception is that they don't want to learn anything new. That's a misconception. So introduce it to your loved one. Say, hey, this is an iPad, or do you want to learn how to do exercise and follow along on this screen, and see what happens.
All right, we are really short on time, so we're going to try to quickly go to the very last question, and we have one more resource to share there, and then we'll wrap everything up. So Melody.
How can I best support my parents when I can no longer visit them as frequently?
This is a great question. So sometimes we think of caregiving as having to be a physical presence, so you're there physically doing something, but there are opportunities thanks to technology for you to be able to do things remotely. So you can, we have this checklist that you can refer to, but some things are, you know, asking your older adult to provide you access to a release so that you can speak on behalf of them with the healthcare team. So you can organize medical visits and get information that way. You can stay up to date on prescriptions, and nowadays there are prescription delivery services from some pharmacies that are free. Create a care circle, so get a group of people who may be able to support on a more day-to-day or regular basis, or even in person. So check out this checklist. And also look at some of the resources we have provided to you, because all of those will give you that a lot has changed with technology that is allowing remote caregiving to be more seamless and more enjoyable, to be honest. So check those things out.
Thank you. And yeah, go ahead, Julie.
Yeah, just to recap, some of the caregiver resources that Portia spoke about earlier: Caregiver Action Network, the National Alliance for Caregiving, Caregiver Resource Center, are all places where you can find lots of ideas, very practical strategies for being a caregiver and for asking for care. Going on to the next page. Just recapping a couple of these things that were mentioned earlier. The Elder Care Locator, I have used this tool. It's fantastic. So definitely encourage you. It's super helpful. And the Department of HHS, their resources for caregivers are excellent as well. Especially if you have a special instance, if you're a caregiver for someone with Medicare, or a caregiver for a veteran, you may find that there are other resources available that you weren't aware of. And then Philips has a really good collection of resources on their resource center. We'll provide that link as well. And from the MedicAlert side, we've brought together a lot of trusted resources, a lot of them around very specific medical conditions. So if you're living now with heart disease or with diabetes or with dementia or a caregiver for anyone in any of those categories, this is a place where you'll find very specific help for what's happening right now with the pandemic, and as well as other general resources. And if you enjoyed today, I encourage you to check out some of the most recent editions. We've covered a lot of ground in this Healthy Hour, and all of these are available for replay on the page that's listed here, medicalert.org, register Healthy Hour. So you can feel free to watch those. Coming up next week, a topic that a lot of people have asked us about, going back to school, and especially for people that have asthma and allergies, whether you are a parent of someone that does, or you're an educator or an administrator that has, that kind of vulnerability right now, this is a really challenging subject. And our partners at the Asthma and Allergy Foundation have spent a lot of time thinking through what does that look like, and how do you create an environment that gives opportunities for learning while keeping people safe. So, so we'll welcome back Kenny Mendez from AFA to talk about that next week. So moving on, we're going to ask you to hang on for a quick survey. I will mention that if you're a MedicAlert member, please be sure to upgrade your health profile and your emergency contacts. It's what we provide to first responders in an emergency. So we want to make sure we're there to help you when you need us. And again, I just wanted to thank PORTIA Singh from Philips. Philips has been a longtime partner of MedicAlert. Our services work very well together, and we're super happy to have you. And I think we have a lot of questions we didn't get to today, so I hope we can invite you back for a follow-up and talk more about some of these things. Like, I think we could do a whole session just on exercise.
Yes.
So thank you, Portia, for sharing all of your help and information.
Thank you for having me.
Delighted.
Thank you so much. So our Healthy Hour will be available on our website tomorrow. So you can see a recording of this event if you enjoyed that as well. So thank you so much, and stay safe. Take care.
Thank you.
Bye.